Welcome. This is a post-operative care video for Advanced Dermatologic Surgery. Today we'll walk you through the essential steps for your perioral linear or flap recovery, specifically focusing on your dissolvable stitches. Following this individualized care plan is the absolute best way to support your healing process, and understanding each step will help ensure a beautiful outcome for your surgical site. Let's begin with what to expect right after surgery when it comes to bleeding. First, please know that bleeding is completely normal, and you should actually expect it for the first 24 to 48 hours. During this time, your bandage might become saturated, and it may even leak a little blood. Please don't worry. When you do experience bleeding, just take some gauze, a clean paper towel, or a washcloth, and press firmly and directly right on the surgical site. It is absolutely crucial that you hold this firm pressure for a full 30 minutes without lifting it up to check. Lifting the gauze interrupts the vital clotting process that your body is working so hard to complete. You might need to repeat this process a few times before the bleeding fully stops, and that is perfectly fine. If your bandage becomes completely soaked and isn't absorbing blood anymore, simply remove it before you apply that direct pressure. Moving on to your bandaging and daily wound care, the very first bandage you leave with will be a large, bulky white bandage made of gauze and tape. We ask that you leave this one in place for a full 24 hours unless your nurse instructed you to leave it on for 48 hours due to significant bleeding. Once you take that off, you'll find a clear, waterproof bandage with a white pad underneath it. It's totally normal to see some blood trapped beneath it. Usually this clear bandage will come off on its own within 1 to 2 days, but if it's still in place by day 6, go ahead and remove it. Once it falls off, you'll begin your daily wound care. Always wash your hands thoroughly first to reduce the risk of infection. You'll want to clean the incision every day with mild soap and water, apply a really generous amount of Vaseline, and then cover it with a fresh, clean bandage. Just continue this daily routine until your stitches have completely dissolved. Now, your stitches are specifically designed to dissolve all on their own, saving you a trip back to the office. However, after 10 days, if you notice any stitches remain, you can gently remove them yourself with clean tweezers. Doing this often results in a much better cosmetic outcome. One quick note, if you develop strong itching along with bright redness, it usually means you're sensitive or allergic to the bandage adhesive. If that happens, just take the bandage off and give us a call. Because your repair is perioral, meaning it's located directly around your mouth, we ask that you adhere to a few specific activity restrictions to really protect that healing skin. Please do not use straws. Eat only soft, cool foods and completely avoid anything hot, spicy, crunchy, chewy, or any large foods that force you to open your mouth wide. During this early healing phase, it is so important to consciously minimize talking, smiling, laughing, and really any wide mouth movements. For your physical activity, please avoid heavy lifting, heavy cardio, bending, and strenuous activity for at least 2 weeks. Heavy lifting can actually worsen bleeding early on, and it can cause your scar to widen at any point during those first 3 months. Light walking is usually fine, but avoid activities that raise your blood pressure, stretch the repair, make you sweat, or put direct tension on the wound. And for your daily routine, you'll be able to resume applying sunscreen, makeup, and scar reduction products, like Silogen, 30 days after your surgery. During your recovery, you will likely experience some bruising, color changes, or swelling around the surgical site. This swelling can sometimes travel downward toward your forehead or eyes, and in some cases, the eyes may even swell closed. This is entirely expected and will slowly dissipate over the course of 1 to 2 weeks. To help with this, keep your head raised and elevated for the first 48 hours. You can use a few extra pillows or sleep in a recliner. Also, please try not to sleep on the side of your body where the incision is. You may place ice near the area, but make sure not to put ice directly on top of the incision for those first 48 hours. To keep you comfortable and manage any pain, you can take over-the-counter medications. We recommend taking 2 extra-strength Tylenol and 1 to 2 ibuprofen every 6 hours, unless a medical condition prevents you from doing so. You may also resume all of your usual over-the-counter and prescription medications now. If a nurse discussed an antibiotic with you today, make sure to pick it up from the pharmacy and take it exactly as directed, with food. If you experience a side effect, simply skip the next dose and contact us. Finally, while complications are quite rare, we want you to be fully aware of the warning signs. Infection most often appears between days 3 and 7. The signs include a fever over 100.4 degrees Fahrenheit, chills, spreading redness, warmth, swelling, thick yellow or green drainage, or pain that worsens after day 3. Another complication to watch for is a hematoma. Hematoma warning signs include a rapidly expanding, firm or tense, painful lump or swelling, a dark, purple mass, severe and increasing pain, or any new problems with vision, breathing, or swallowing. Additionally, if your bleeding does not stop after several back-to-back attempts of applying that firm, direct pressure for 30 minutes, this is also a warning sign. Please contact our office with any questions.